My name is Danielle, and today I'm going to teach you about ostomy care. First off, what do you know about ostomies? Great. Today I'm going to educate you on the proper appliances, maintenance, and removal of an ostomy dressing. I will also teach you the importance of maintaining skin and stoma integrity and how to understand if an issue may be occurring. Before we start, an ostomy is a surgical procedure in which an opening is made into the abdominal wall to allow the passage of intestinal contents from the bowel, which is a colostomy, or urine from the bladder, which is a urostomy. There's proper appliances you use. Depending on the system, you can use different items. Skin prep helps the bag stick. Paste. Some people use paste, some people don't. It depends on the person and the preference. You also need to have your scissors and all your appliances, your clip, your bags, and your wafer. So the proper appliances, your pouch system must be selected and fitted to the person's specific stoma. You will cut the appliance to fit the stoma site. You always want to use a skin sealant, preferably without alcohol, and allow it to dry before the application of the appliance, which would be the pouch. So before you place this on the skin, you want to make sure the skin prep has completely dried. If this system already has the bag and the barrier connected, but some systems have where it's separate, so you'll need to make sure that you attach the bag to the system, to the barrier, and then you'll apply the barrier or wafer to the skin site with the stoma and the cutout. So when you measure your stoma, you'll measure it here and cut it out, so you'll make sure that wherever you cut your opening goes right where the stoma is. You want to make sure all of the stoma is visible and none is covered up and the barrier is flat on the skin while ensuring a tight seal. That way you don't have any leakage or issues. You also want to ensure the bottom of the bag is velcroed or clipped shut and tight, depending on your appliance. This appliance has Velcro, so I would Velcro it shut each time. Some of them don't have the Velcro, they just have a clip. So you'll just put the clip right here to keep the appliance closed. Proper maintenance. You want to make sure you assess the condition of the stoma at least weekly, including the location, size, protrusion, color, and integrity, the presence of peristomal hernia, if there's any pain or swelling, and signs of ischemia such as dual coloring or dark or purplish bruising. If so, you always want to report that to the healthcare provider. Everybody has their own routines. I've had a lot of patients with a lot of different bags, a lot of different systems and ways they change things. Typically, you change the ostomy bag every 2 to 4 days or as often as your healthcare provider recommends, and also as needed if you have any leaking or busting. You'll change the wafer appliances every 3 to 4 days or twice a week depending on orders from your provider. You'll always make sure to empty the ostomy bag when 1/3 to 1/2 full of stool and monitor for gas fill-up in the bag and empty release gas as needed to avoid your bag from busting. Removal. First, you want to prepare by providing your patient with privacy and have them lie supine, which is on their back, lay down for easier appliance removal, and you want to put on clean gloves. To start the removal process, you want to empty the pouch of any stool inside. Gently peel the skin barrier away from the skin, working from one edge to the other. If removal is difficult, you can use an adhesive remover. Place the old pouch, wafer, and other waste, not the clip if one's used at the bottom, because you want to save those. Usually only 1 to 2 come per box of wafers, into a plastic bag for proper disposal. Then you want to clean the skin around the stoma and allow it to dry thoroughly before starting the process of applying a new ostomy barrier appliance. So skin and stoma integrity is very important. You want to assess the skin around the stoma for any excoriated skin, leakage under the drainage system, presence of inflammation or dermatitis, fit of appliance and effectiveness of skin barrier and appliance. You want to make sure the skin around the stoma should be intact, smooth, and without redness or excoriation, and monitor for any skin complications due to fecal content getting on the skin stripping, or fungal infection, and report that to the healthcare provider. All right, so that sums up our teaching learning about ostomies. Can you tell me what you've learned today about ostomies? Great, and do you have any other questions? Okay, well, thank you very much for my teaching learning comp today about ostomies. Have a great day.